The UK's biggest university, London, reopening its doors today. Now, if it looks like mixed messaging, with what is clearly a second wave of infection about to break, it is. Even as students ease their way into term, the English government is considering national lockdown. Mixed messaging and hyperbole. The Prime Minister gave us world-beating, then moonshot. Welcome today to the circuit breaker. Under consideration, back to March, locking down again for 2 weeks in October to break the second wave, and possibly several times again over winter.
We are now seeing a second wave coming in. I don't think anybody wants to go into a second lockdown, but clearly, when you look at what is happening, you've got to wonder whether we need to go further.
This feels very much like we were in February, and so we need quick, decisive action on a national scale from the Prime Minister. He needs to set out what he's going to do and reassure the nation.
The circuit breaker would likely coincide with the school's half-term break. The direction of travel is obvious, from genuinely local lockdowns just a few days back to regional lockdowns to, well, you know what. Only on Monday we had named towns on lockdown: Caerphilly, Leicester, Bolton, among others. Friday, and its entire regions, Lancashire, Merseyside, parts of the West Midlands and West Yorkshire, joining the northeast restrictions announced yesterday.
This is a serious moment for the whole country. The number of cases is accelerating. The number of people going into hospital with coronavirus is doubling every 8 days. The first line of defence is people following the simple rules, the rule of 6, hands, face, space, and then local restrictions if you've got them in your area. It is so important that people do that.
His line manager at a lab today in Oxford as the Office for National Statistics announced that 6,000 people in England per day were newly infected in the first week of September, almost double the previous week. The R rate, the average number of people a person with COVID goes on to infect, has risen to between 1.1 and 1.4 in the UK overall. In Northern Ireland, it's around 1.2, in Scotland 1.1 to 1.4, and in Wales it's between 0.7 and 1.2. Similar increases across England, the highest in the northeast and Yorkshire, the northwest and the Midlands. You cannot stop a second wave if you cannot test for one. Wolverhampton today, in the same dispiriting story replicated in other locations. An almost deserted COVID testing station in a country where so many can't get tested. The government says only get a test if you have symptoms. In Wolverhampton, they said this.
So I've told work, and they've asked me to get a test as well, even though I haven't got any symptoms.
Our colleagues, he's got the symptoms, so I thought, as a precaution, make myself tested as well.
The Prime Minister talks about Operation Moonshot. Welcome to Mission Control in West London, home of the 90-minute COVID test from Imperial College.
So here is the swab, Alex. It's a paediatric swab.
Here goes. So, is that far enough?
Insert the swab into the magic black box. Have a cuppa. 90 minutes later, your result. Negative, incidentally.
There's a huge trade-off here between speed and accuracy, and the beauty of a test like this is that it's got the accuracy of NHS instrumentation, but it's got the speed that enables you to bring it close to a patient.
Scaling up needs to be massive, with each box producing just 16 results per day. They insist, though, that is possible, and the overwhelming need is obvious.
It's a lot of work, isn't it?
It is.
The testing moonshots still on the launch pad. And far from being world-beating, it was revealed just last night that the NHS has been begging the Irish Health Service for testing assistance just this week.
Alex Thompson. Well, yesterday the World Health Organization warned of alarming rates of transmission across Europe, saying it should serve as a wake-up call for all of us. Joining me now from Geneva is Dr. Margaret Harris from the World Health Organization. Dr. Harris, Boris Johnson says a second wave is coming. Is that your assessment too?
Good evening, Jackie. What we've had all along is transmission, and we're now seeing a big rise in transmission. The moment when it was really brought down after everybody had been in lockdown, unfortunately, that moment was lost. That was the time to ease the lockdown, learn to live the new normal, not the old normal, but unfortunately people went back to the old normal, and we are indeed seeing a big rise in transmission.
And you're seeing an alarming rise in deaths in Spain yesterday, for example, and it was always said that the UK was a couple of weeks behind Europe. Is that what we can expect here?
Certainly, again, the concern is exactly that, a rise in deaths, but also a rise in people who need hospital care. And with the winter coming, the colder months, you've got many other viruses that arrive, and people tend to have an exacerbation of chronic disease in the winter. You want to keep that space for all those other things rather than have the hospitals overloaded with everything.
So what should we have done differently?
Should have listened to the message. Now, it's a hard one. It's a very hard one in the middle of summer. People felt they'd done their bit and they were looking for their rewards. So there was too much physical contact, too many gatherings. I mean, it wasn't necessarily the pubs and nightclubs. A lot of the gatherings were in homes. People just thought they really were going back to this old normal. We have to learn the new dance, the coronavirus dance, to protect ourselves.
You say they have to listen to the messaging. Are you saying the blame lies with people for not hearing the messaging, or was the messaging not clear enough?
Not at all. The first thing with good messaging, good communications, is listening to the people and understanding what their concerns are and what they understand about what needs to be done. So you really need to pump up the ability to do that one-on-one communication. You do a great job with the media. All the material you put out is marvelous, but unless you're really listening to everybody, it's in their language, their culture, their ideas, whether young or old, it's not necessarily going to get through.
I mean, briefly, if you would, there have been considerable problems with testing here. The head of Test and Trace, Baroness Harding, essentially said yesterday nobody could have predicted the really sizable increase in demand for testing. Is that correct in your view?
Well, we have been saying right from the start, when we called the alarm to the world on the 30th of January, that testing was essential. Perhaps for many countries, they didn't understand the enormity and the scale, and initially people were testing the sick, hadn't realized that there were many people who are asymptomatic. So these things do on you.
Dr. Margaret Harris, thanks very much for joining us this evening.
It's a pleasure.
Now, the First Ministers of Scotland and Wales have joined the calls for Boris Johnson to convene an emergency Cobra meeting this weekend, as Nicola Sturgeon warned the next few days would be critical. Wales's First Minister said there must be better communication with the devolved governments, warning there was a vacancy at the heart of the United Kingdom. Our Home Affairs correspondent Andy Davis is near Pontypridd. Andy.
Behind me lies Rhondda Cynon one of two county boroughs in Wales under local restrictions right now. And we heard today that two other areas, Merthyr Tydfil and Newport, are under close watch. The First Minister, in a press conference, was asked about the talk today in England of a possible 2-week national lockdown there and whether Wales might follow suit. And he said the case had yet to be made. But it was on this issue and on the issue of ongoing problems around testing that he emphasised again what he sees as a need for discussions at the highest levels between the First Ministers of the devolved governments and the Prime Minister. He joined Nicola Sturgeon in calling for an urgent Cobra meeting. And in words laden with clear irritation, he said that in this most difficult week, there'd been all sorts of difficulties, no offers of a meeting to any of the First Ministers. He said that it had taken one brief phone call from the Prime Minister. He'd had just one phone call from the Prime Minister since the end of May, and he called again for a regular, reliable rhythm, as he puts it, of engagement. And it's this phrase and this appeal we've heard so often from him. It's now almost echoing through these press conferences.
Even a single meeting once a week would be a start. And I make this argument not because I think we should all do the same things, but because by being around the same table together, each one of us is able to make the best decisions for the nations we represent. There is a vacancy at the heart of the United Kingdom, and it needs urgently to be filled.
A call too, as I've mentioned, for urgent discussions from Scotland, where the First Minister, Nicola Sturgeon, said today with accelerating COVID cases, this weekend would be critical in determining whether any further restrictions would have to be introduced in Scotland.
As widely reported, SAGE met yesterday. I have chaired a meeting of senior Scottish Government officials and advisers this morning to assess the current situation, and discussions across the 4 nations of the UK will, I hope, take place in the coming days. I've this morning asked the Prime Minister to convene a Cobra meeting over this weekend.
So will they get their Cobra meeting? No indication of anything imminently on that front, but a statement from the Cabinet Office saying there'd been hundreds of meetings between the UK government and the devolved administrations, and that would continue.
And Andy, there's been some concern from the First Minister there about the issue you were raising yesterday about people travelling long distances to be tested.
That's the Abercynon Test Centre we were reporting on yesterday, advertised as for local residents only, but where we met lots of people being directed from England to be tested. The First Minister raised it with him today. He said that it made no sense that this was happening, that people were travelling long distances into an area with higher rates of coronavirus and in a form of local lockdown. And he said that he would be trying to iron this issue out with the Lighthouse Lab network today. Among all the other issues, no doubt, those labs are trying to iron out right now.
Andy, thanks very much. Well, Liverpool is one of the places where new lockdown measures will come into force on Tuesday, and I'm joined from there by the Mayor of Liverpool, Joe Anderson. Mr Anderson, Boris Johnson says the second wave is coming. Is that what it feels like in Liverpool?
Yeah, it does, because we've seen a massive increase over the last week, around about 500% increase. 550 cases in Liverpool. That takes us up to about 1.4 on the R rate. 150 people in hospital here. So there's real concern, real anxiety about the levels and increase in COVID-19, and it's a real worry for us.
So these new lockdown measures, should they have been introduced earlier, do you think?
I think so. I think what I'd like to see, though, is some clarity, some consistency in delivery from this government. The lockdown measures themselves, or the restrictions that are being put in place, not just in Liverpool and the city region and the northwest, but also the northeast, are fine. But it's about actually then making sure that we actually deliver on those restrictions as well. So, you know, for instance, the government talked 10 days ago about introducing marshals to support cities and towns and boroughs being able to monitor people abusing the regulations, the rules of COVID-19 about wearing masks and stuff on public transport. Since then, there's been no information from government about whether we're going to get any support for those marshals.
But I mean, is there an argument that the city itself should do more? You as mayor should do more?
Well, in terms of we've got little powers to actually control, you know, in terms of the people of the city with lockdown measures. That can only come from central government. We've been given real strong messages out for the last 3 weeks about following the rules, following the guidelines, and we've seen these restrictions imposed on us today, which incidentally I welcome. But what I actually want to see is that there's a consistency of message. For instance, you know, we've been given these restrictions today, but we're not having them in place until Tuesday, 4 days. And for me, you know, we've got the government and the Prime Minister in the last hour talking about, you know, potentially a lockdown across the whole country because the situation is that bad.
Very briefly.
That lack of clarity.
Very briefly, if you would. I see the Liverpool Echo is running a survey saying that while the vast majority of people want further restrictions, they fear people won't stick to them. Is that a concern of yours too?
Absolutely, it's a concern. And that's why we've seen the increase in infections. And that's why it needs clarity of message from central government, delivery of you know, its purpose about, for instance, testing and tracking and tracing and the things it promised 6 months ago would have in place. So we're not seeing any of that. So I imagine that without that consistency and clarity of message, people will feel that there is uncertainty and continue to behave as they have done in the past.
Joe Anderson, thanks very much for talking to us.